Okay, everyone, we'll go ahead and get started. This is Ginger Bandine with Pinnacle Health Informatics. So welcome to our webinar. We're so excited to talk to you today about how your data is your superpower. So first of all, thanks for joining us. If you're here, we have a feeling you already know these things. You already know that your agency's access to data is important, and you know that it's only getting more important and that your need is urgent and increasing every day. The impact of the change to value-based payment is affecting you, and you are probably thinking, how am I going to get this data that I need to help drive better decision-making and stay abreast of all the changes that are happening in behavioral health? And you're probably also realizing that your electronic health record isn't necessarily designed for easy data analysis. It's designed for getting data into a system. It's not necessarily the best tool for getting data out of your system. I'll take a quick second here for our team to introduce themselves. Sean, would you like to go ahead?
Yes, this is Sean Fraser with Pinnacle Health Informatics. Thank you, everyone, for joining today. Several of you, if not all of you, we had the opportunity to chat with at the Open Minds Technology and Informatics Conference in Philadelphia, so that was a real pleasure. We love data. We love working with data. We're very excited about it. We're going to show you some really cool things. We've worked with data for a long time. We know a lot of the frustrations and pain points, and we are here to help alleviate those. So thank you all for coming.
Thank you, Sean. This is Gary Clark. I'm one of the co-founders along with Sean and senior software engineer here at Pinnacle. And we just want to thank you again for participating in this today, taking the time to allow us to share this fantastic tool that's been developed with you.
Thanks, Gary and Sean. And I'm Ginger Bandine. I'm the Director of Clinical Data and Analytics. And Sean and Gary forgot to say what their superpowers are. So Sean's superpower is relationships, both data and otherwise. Gary's superpower is storytelling, and you might get a chance to hear some of that today, and that includes with data and otherwise. And my superpower is my clinical eye, because I am a social worker by trade and taught myself data over time. So I think there's some other clinician turned data people on the call today too, and we're awesome, and it's a superpower. All right, so a quick statement about terminology. So you're gonna hear us talk today about use different words when we're really describing the same thing. We're gonna talk about the tool we're using. We're probably gonna sometimes call it the cubes. We're probably sometimes going to call it SQL analysis services or a data warehouse or all these different technical terms. But basically what it is the engine behind the scenes that gets your data out of your electronic health record and presents it to you in a useful fashion so that you can do all these fun things we're going to show you today. So if you hear us use those terms, that's what we're talking about. And without further ado, I will let Gary take it away.
Thank you, Ginger. And thank you all again. What we're going to be looking at today is some of our data cubes, and we'll be doing that using Excel pivot tables to start with. And in this case, we're looking at our service cube. And let's take a look at a service measure here. We're going to look at encounters. Encounters are just simply a service that was provided to a client. You can see we have 2.4 million. That's not very helpful because it doesn't tell us anything about that 2.4 million. We don't know when or where those services were provided, or nor do we know by whom, for how long, simply that they exist. So let's start filtering the data. And one of the most often used filters would be our fiscal year. So in this case, we're going to filter it for our current fiscal year, 2019 to 2020. And you can see that that's dropped significantly to 194,000, that is. But let's take a look at this by the month. And so you can see we just drug the month up into the columns there, and instantly we have a report showing this encounters by month. Now in this case, we'd like to add and look at this by program. So we're going to bring in the location cost center. And you can see that just like that, we've created a report in no more than about 30 seconds. We've separated the technology from the data. We no longer have to fight to join tables, to understand how everything is linked in the background. We don't have to know where data exists. It simply is. It's there. It's easy to use. We can change this data as quickly as you can think about it. So in this case, I'm going to bring in the reported service provider ID to protect the guilty or the innocent, as the case may be. We'll just show the ID field. And we can collapse this data. We've got it now by the program and then by the providers beneath the program. And again, we're blurring some of this out to protect PHI. And here we've expanded it. So it's very, very quick and easy to use. It's very functional. It's very fluid in allowing you to look at different data in different ways. We can change this report from services to bringing in the unduplicated client count. We can show them together. We can bring the encounters back out and show only the unduplicated client count, which makes it much easier to do. And unduplicated client counts are very difficult to get in just in Excel. So the cubes make that very easy to do. Are there any questions to this point?
I don't see any, Gary. We can go ahead and go.
Well, I just wanted to say, it's kind of amazing. There's a whole discussion we could have about extraction of the data. We have processes that connect to your EHR that extract that data out automatically, and that's a whole other conversation. But that's how the data got to be into the data warehouse and into these tools.
Great, thanks, Sean.
All right, so now let's take a look at the service data. Again, we're going to be looking at it in a little bit different format this time. We'll go to the service measures. We're going to get client hours and provider hours. We'll bring in the provider hours, which are difficult, again, a difficult item to get because providers attend groups, and group productivity is measured differently than client productivity. So the provider hours and client hours are measured differently. Here you can see that. If we look at the cell that's highlighted, you can see we have 14,000 client hours and only 2,600 provider hours. My guess is that that particular part of the organization, that program, provides a lot of group services. Incidentally, those provider hours are also correctly adjudicated across groups, across day treatment. So if providers come and go, if you have, for example, 2 providers providing group, or if we have multiple providers or multiple clients that come and go before they should, or stay late, whatever it may be, that will all be correctly adjudicated. So any questions now?
I don't see any, Gary.
All right, let's continue. And in this case, we're going to be looking at what we call the client cube. And this is based more around client demographics. Social determinants of health are going to be a big part of the client cube. And
well, this is nice because it's a visualization, which is a really nice way to look at data. If you're a clinical person, lots of times clinical people can picture data better than just seeing numbers.
Thank you, Ginger. Yes, that's absolutely true. So it's the same data. We're looking here at the client hours, the provider hours, but we're looking at them in a visualization rather than in the a crosstab report. Here we're going to add in a couple of trend lines. That makes it even easier to see where our data is going. And as you can see in this particular case, our provider hours are remaining the same, but our client hours are dropped dramatically. And that may be due to the fact that we're providing fewer groups at this time. That may or may not be a good thing at a particular agency. I have worked at times at our agency when providing more groups was not really beneficial cost-wise or financially to the organization. And here we're looking at it across our various programs rather than by month, the same data. We can see that in the case of substance abuse services, we have a lot more groups available there. Now we look at it again by month. And let's come in here and add a parameterization tool called a slicer. So we'll bring in a slicer, and now we can take the data. We have it broken out by month, but now we can also look at it by individual services. So we can look at our substance abuse services, PACT, mental health, bring in multiples if we want. So a single one, we could bring in all of them by removing the filters that are on that. A very powerful tool. This would have taken literally weeks to do in the previous tools that were available prior to the newer versions of Excel. And once again, here we can look at it by month and by program at the same time. Again, very, very fast, very easy to use. You haven't seen us do any table joining or anything like that in the background. I consider it really kind of Harry Potter magic. I know that may sound a little bit corny, but I've got to tell you, having spent so many years in this industry and fighting to get data when I needed it, this is an incredible, powerful tool. And this is just one piece of it. Of course, we'll be showing other parts as we move along.
And really, we can connect with any modern data tool, right? Any modern data tool, any data visualization tool, any reporting tool. So it's very flexible in that regard.
Thank you, Sean. Exactly. So any questions?
I don't see any, Gary.
Thanks. All right, now we are into the end of the client cube, and we'll be looking at some social determinants of health, I believe. Oh no, we're in the financial cube. I apologize. So we're looking at the financial cube. Let's take a look at adjusted revenue. And again, we can look at this very quickly by dates, by times, by people, by programs. Let's take a look at it. We filtered it, or we can now filter it on the fiscal year. We're going to select multiple fiscal years. Take this fiscal year and the last fiscal year. And just like that, we've got the data back. And you see how fast that data is being returned, thousands of times faster than out of the production system. We can look here and we can see very quickly that in July we had a large negative number, and we'll be able to see that in a visualization here coming up as well. Bring in the programs, just like that. And we now can see all of our adjusted revenue by program throughout the organization. Again, it doesn't matter whether we're looking at services, at clients, at financial data, it's all just as fast and it's all just as easy to use as this. Training only takes a few 1-hour sessions, and we can have anyone in your organization using these tools. In addition to that, all of the tools that you're going to see can be our standard Microsoft tools. They are all available for training on YouTube or through any kind of book that's out there available. It's all standard. There's nothing special about it. Here we're going to look at our adjusted revenue again, and we're actually bringing in the revenue and the payments as well. Bring in the fiscal year as a filter again. And our service month. Here you can see that July adjustments were really big. Again, my guess is the agency did a number of write-offs for that particular month. Beginning of the fiscal year, they probably said, let's go in and write off everything that's over 365 days or anything over 180 days, whatever the case may be at the policy at their agency. Let's insert a slicer so we can slice and dice this data a little more. We'll bring in the cost center. And here you can see that just as easily as with service data, we can filter our financial data by using these wonderful parameter tools called slicers. Very simple, very easy to use. And again, we can train anybody to do this in a matter of 3 or 4 weeks of 1-hour trainings. And that is just part of what we do. So any questions to this point?
I don't see any.
All right, great. Thank you.
I was just thinking how much nicer it is to look at that graph than all those numbers from a clinical side of things.
Well, it is. It absolutely is. And for presentation to higher level staff at the C level, they're going to want to see the visualization rather than that pivot table. Let's look at some social determinants of health. In this case, we're looking at living arrangement, which is a very valuable tool in measuring outcomes. So in this case, we're looking at living arrangement versus legal status.
As you can see, there were several social determinants of health in there. Education, any of the things you guys are tracking at your agency, you could pull in and then find where people's social determinants of health maybe intersect.
Thank you, Ginger.
And part of what makes this work so well, and we've kind of talked about our tool, but the tool does all these intersections ahead of time. That's what makes it so fast. That's the clinical version of explaining that technical thing.
Thank you. And that's exactly right. Everything is pre-compiled ahead of time so that every one of those values, for example, if we look at involuntary civil, they're at about 16,000. The cube already knew it was that value. It didn't have to create a query and then build that out from there. As you can see, we have any numerous types of visualizations available that we can use. Line charts, columns, pie charts, whatever you like. Anything that's available in Excel is available here. So let's bring in a clustered bar chart. And in this case now we can see this data in two formats side by side. We can come in and filter this. Perhaps we want to look only at involuntary commitments, involuntary legal status. Sort it by smallest to largest within the visualization, largest to smallest. Let's expand that out so we can see what that top row says. If it's too small, it doesn't show up. So we'll expand that out so we can see all of it. So that was involuntary civil commitment.
And just like that, you can switch it to living arrangement. You could look at various different social determinants of health that way.
Yes. And as Ginger said, marital status, education, disabilities, all of these are available.
Veteran status.
Veteran status. All of these are available inside the cube. Employment, allowing us to look at outcomes or people's lives changing based on the therapy they're receiving.
Yeah, I like what you mentioned, Gary, about that this is all available. These are standard tools. So, for example, for you clinical people listening, I took a class at the community college to learn some of these tools because you can take a class just anywhere on these things. It's not like some of the software that's available through the electronic health record vendors. You have to take their training and learn their thing. But, anybody out there who's taking a class at your local community college could navigate this stuff and do really advanced stuff. So I don't see any questions, Gary, so I'll let you.
All right. Thank you.
Continue on here. All right, I think now we're going to do some Power BI, which is another really cool tool. We're going to let Sean take the lead here. Go, Sean.
So Power BI is a big deal right now. Everyone's talking about it. At the conference, everybody was talking about it. There's a lot of really nice visualization tools out there, but we can see here, you can expose the entire cube, all the measures, all the dimensions, just like we did in Excel. Search through. Let's go find encounters like we did before. Let's go look at these by service date. Let's drag those values in, and we can bring them in and add some context to our data. So here we have encounters for all time. Bring that in, and we can expand this out and sort it a little bit. Looks like the sort order isn't correct, so we need to change that in Power BI. So we'll go ahead and do that. And I'll probably have to change it a couple of times to get the right sort order. But that's not an issue. We'll bring in some filters. So we can look at our data. Let's go ahead and sort that a little bit differently. Maybe that will look a little bit more meaningful. There we go. And let's go ahead and look at the trend in that data. So that quickly you can see, again, the cube is like a single source of truth. You don't have two people making different data models, one in accounting, one in services, one in utilization. Everybody's got the same data model in the cubes. They're all vetted over years and years of work over lots of agencies, and so everybody's getting the same data. It's all proven data. It's all very fast at your fingertips. You see here we can bring in some filters, and we have all the interactivity that's available through Power BI. We can bring in some interesting additional information. repurpose
And the other thing
our
that's
charts.
important about that consistency, Sean, is, we don't want people to see the data and say, oh, well, this data is not right. None of my data must be right. I'm not going to worry about data. We want people to believe in their data because people are more likely to use it then.
Absolutely, absolutely, and that's a big issue because of these tools can be used widely used by people, but we do see that a lot. We see that two different people get two different results, and then we have to run those all to ground. But with this tool, everybody gets the same result, and it's all proven, and all the data lineage is there, and everything ties back in. So everyone can use it with confidence, and it's one source of good, solid information. So I'm just right here. We're just bringing in some filters. We're going to add a program filter here, like we did in Excel a little bit. And you can just see how easy it is to search through that cube metadata and get those values. I mean, there's literally hundreds of dimensions, dozens and dozens of measures. We're adding measures if clients ever need measures or calculations. We add those to increase the analytical power of the cube. Huge time saver. We've done studies where we're literally saving people thousands of hours a year. And in addition to that, making better decisions and getting better patient care for their clients. So you can see here, very simple to sort. You can see how interactive it all is. If we change those, the chart changes. We can see our average line changing. And this is a live connection out to the analysis services database. So this is not a relational database. It's a OLAP, or analysis services, through Microsoft's analysis services. At least 1,000 times faster by Microsoft's own calculations than a relational query, at least 1,000 times faster. And we've seen it tens of thousands times. So once we can bring in another measure, we can bring in unduplicated client count. So we can see here that the encounters are going up, but the client count's staying about the same. Any thoughts, Ginger, on that?
No, I was just going to say, I forgot to say OLAP is another word that we might use to describe this tool. Yeah. There's always another term.
Yeah, thank you.
Nope.
So we can see that maybe the client count or the encounters is going up a little bit. Client count maybe not so much. Very quick and easy to look at your data, play with your data, explore your data. Data discovery is a term you hear a lot. Very simple. Any questions?
I don't see any, Sean.
Okay, we move on here. Let's go look at something else here. Okay, let's try something else. We'll try a bar chart here just to illustrate the speed and efficiency of the cubes. We're going to look at provider hours here. We'll take a look at it by provider ID, bring that in. Oh, there's a lot of providers at this agency, so there's a lot of data, but we want to kind of look at the top 10. So we'll go ahead and very quickly bring in a top end filter into this. And we see already we have one provider that's an outlier, and so there's probably something going on with that. We could filter that out or create a drill down to see what's going on there. Let's go ahead and drill that, or let's go ahead and eliminate that, just so that we can look at the other providers. There's probably something going on there it's probably not an actual provider, or it's somebody recording a ton of services or something. So we'll go ahead and filter that out, and now you get a little bit better picture of your top 10 very quickly. And again, this is all just going out to the cube. These are queries that would take minutes, hours, days previously without the cube, and now they run all in memory, all pre-compiled. We see if we do it top 20, we see another little bit of an outlier. So again, that data exploration could continue on, and we could do more examination of that very, very quickly. Let's go ahead and add something else. We want to see kind of the breakdown of that data. Let's add a heat map in here, a tree map. Let's see how that breaks out by program. And again, the built-in visualizations can connect to the cube very quickly and efficiently and get us some insightful data. So let's look at that by provider hours. We're going to make sure that visualization's selected, and then we're going to drop in. Again, let's bring in some program, agency, location, cost center program. And you can just see how quickly that compiles the data, and as you click on the various visualizations, it reflects over in the other. So you can see it, even though it's a very thin line over on the tree map, you can see that there's some composition there. But going the other way, it's much more stark. If we click on, say, adult case management, we can see how that reflects. And that's one of the beauties of Power BI, but also the the power of the cubes that are able to serve that data up just so quickly and so efficiently. So you really spend time, whatever tool you're using, you're spending more time analyzing, discovering, producing data rather than figuring out where all the data lives, which can be frustrating. And again, Power BI is a great tool. We also use, we'll look at another tool here in a moment, but there's many tools. They all play great with the cubes. It's a great foundation. We bring a lot of other data sources into the cubes. That's a whole other conversation. HR data, time clock data. We'll actually look at a couple of those here as we move on. Any questions?
I didn't see any, Sean, so we'll go ahead and keep going.
Okay.
Let's talk about combining data from different systems.
Okay. And this is where the real power comes in and where the EHR really can't do at all. You know, you're sort of left to your own devices. And we do this all the time. Here's an example of a very popular productivity dashboard built in SQL Reporting Services that combines EHR data, time clock data, position control data, and HR data. And you can see here the colors kind of tell a story very quickly. You can see by the gray bar, that's how much time people have been at work, punched into a time clock year to date. The red bar is how much time they've produced, how much service they've provided. The gold bar comes out of the HR system. It's their yearly goal. And then we see how that breaks out. They're at 33% productivity. They should be at 65.20. And then we can see the trend here. We can also drill right down into this report and see the detail. Here's somebody who's making their productivity. You can see that everything's changes color to green. You can see over in the trend that they weren't always making their productivity. There's a little bit of a red trend there. This also has to run based on a position control system. So a supervisor automatically can see all of their direct reports and see how they're performing. This runs for over 500 providers at an agency. It runs hundreds of times a day. If it's not running at 8 o'clock in the morning, we're getting emails and phone calls. We've seen massive productivity increases in their providers, among their providers, up to maybe 60% in some cases, just being able to monitor this. So we're seeing, you can drill down to the details, so you can get right down to the individual service detail. So they can check every service that they provided during that time. So very popular, those sorts of dashboards that combine data. That's a big request from our clients, is bringing all their data sources in and then looking at them together in the cube. So very powerful, very fast. Any questions or comments?
I don't see any questions, Sean. I was just going to say that, one of the reasons it's nice to bring in your HR data is that way when providers see their productivity, it's not looking bad because they were out on FMLA or they were, they had a training they went to for a week. So that way you can kind of factor that in. And I know agencies I've talked to who are using that approach say that really helps with morale. So people don't feel so burned out, like, oh, I'm behind now, I'm going to be catching up forever. So that's a really helpful aspect of having your data combined, which wouldn't be in your EHR.
Right, exactly. So another exciting frontier that we're embarking on, that the cube is the great foundation for.
Hold on one second, John. Sorry, it's getting there.
Is predictive analytics. But first we want to look at a little bit more info here. This is engagement variability, or it is access to care. So this is a client that wanted to see how much time elapsed from the days from attended initial to first service. And so, but we need to know the data variation. And so we look at this over time, and we look at it by quantiles. And so we look at it by the maximum, the minimum, the median, the mean. And so they want to see that shrink. And this has actually been a fascinating one to work on, because by having these reports that show that variability, they can really manage that. And again, these are fast to create because the cube has all of these things built into them. Any questions?
I don't see any, so I'll let us keep going here.
Okay. Maybe I jumped the gun a little bit. I think the next one is we're going to talk a little bit about, this is something that's also interesting. This is another one where we combine data for productivity purposes. We actually bring in time clock data. We give a trend of productivity, and then we actually compare paid hours to provided hours. So, and we spend a lot of time building visualizations that are quick to understand. And so with the bullet charts there on the right, you can quickly see kind of where people stack up, where providers stack up, who's providing hours in relation to paid hours. And you can see very quickly how that tracks out. We give trends so that you don't, this month may be good, but the trend may be not so good, or this month may be down, but the trend is good. So those are important things to know. We have some drill downs on this where we run running averages. Again, these are great because they help people, but it's really the ability to have your data and do things with it, right? It's not tied up in an EHR. It's in a system that you can get to and combine and work with. And so it really accelerates the data usage process and the time to value for your data.
Yeah, that immediate feedback is really important and helpful. We all know that as clinicians, but sometimes we forget to do that for our clinicians. So I think, or our supervisors or managers, just that immediate feedback is so helpful. I don't see any questions, Sean.
Okay.
Oops. Sorry. I accidentally hit rewind for a second.
We can do it, watch it again. That's all right.
Go ahead.
Okay, so another thing we try to help our clients do is keep track of things and avoid problems. In audits, they want to see that you've done proper paperwork, and so we use the data warehouse to build scorecards like this where clinicians can see their caseload and very quickly see the status of how many they have in compliance, how many are out of compliance, how many are due soon for services or assessments, with drill down. So this one, that you can see at a glance, all the summary at the top, but then you drill down and you can see all of the different statuses of a provider's caseload. And our hope is that that our agencies that we work with use these tools to avoid audit findings. We've built these in response to audit findings, and they've performed much, much better as a result. But you can kind of see here, with drill downs, you can see all of the documentation that's due. This actually will run, this is more of a supervisor version. This is a version that shows all providers with their caseloads, but we have this running out of the EHR that detects the username, and then it runs for just a provider, right? So an individual provider can run it just for themselves, which is nice. And that's been a huge help, and they're much more compliant and giving much better care as a result of that.
Sorry,
okay.
I forgot to pause there for questions, Sean, but I don't see any, so I'll let you go ahead and explain this.
So this is a dashboard out of PowerBI that uses some of the AI and time series analysis features. So we have a portion in the cube that looks at a whole bunch of events, and we want to be able to kind of see how those might play out in the future, because we have this good data and it's very fast to use. The engine here in PowerBI can do some major calculations to look at the probability of things moving forward. And we see here that for this weekend, just like every other weekend, we're predicting low counts over the weekend. So that area in the gray is the next forecast. It's the next 10 data points. We can kind of see that the weekend looks low, but we can see that next Monday we're expecting about 25 events. Things will drop down to a certain level, and then we can see the week kind of play out, and it can do this with about a 95% confidence interval. So those are some of the predictive things. So your superpower can become a predictive analytic professional using some of these tools. And the data warehouse is a great tool because it's fast, right? It can do millions of iterations on an algorithm in a short time, whereas relational data, it can take much, much longer. But the cube is a great source for data science and for analytics. So very exciting stuff.
Well, thank you so much, Sean and Gary, and for sharing some of those data tools that we're seeing people use. Can you guys raise your hand if you're not seeing my screen? Are you guys seeing my PowerPoint slide back again?
I am. It looks good.
Oh, great. Thanks, Sean. Thanks. Sorry. Okay. So we wanted to talk a little bit about the future of Pinnacle Health Informatics and what we see as the future of how we want to support the behavioral health community. So, one of the things that we're excited about is building and supporting a community of data superheroes. So all of you who have listened to this information and are thinking about data, the people we met and talked to at the Open Minds conference, all those people out in various agencies across the country who are starting to think about data, who are wanting to take better advantage of all this data that we're entering into our electronic health records and help that to drive better decision making. We want to help support that community. So we do that right now through some user groups. We also have an executive advisory board. We do webinars that are published on our YouTube channel that you're welcome to check out. Those are all available to anyone. But that's part of what we want to do, is build and support a community of data superheroes. And as you saw, Sean showed some preliminary work we're doing with predictive analytics, but that's really the future of the data industry, is that we're going to be developing more advanced analytic tools. There's some interesting conversations happening around the ethics around like artificial intelligence and algorithms and things like that. My whole thought on that is the only way we are going to, there's some controversial things about some of those things, but that's why we need more behavioral health professionals and more agencies engaged in that process, because we need to have a seat at the table. And to do that, we need to be doing some of this work and understanding how data works and using our data and understanding it. So, and then another future plan we have is over time to develop some standardized data models that can be used across agencies, so that if you wanted to compare yourself to a similar size agency that we also work with, if we can develop some ways to de-identify the data and make it standardized across agencies, then you would be able to compare yourself to a similar agency in another state or a similar agency in your state. We see that as also a powerful use of data that is not being the industry just hasn't figured out how to do, and we want to be there to do that. Anything you would add to that, Sean or Gary?
Oh, I think it's what we enjoy is working with our clients, and we're excited about data. We're enthusiastic about data. We love to hear about projects. We think there's so much value and improvement and benefit that can be gleaned from this data, and we feel like we're just scratching the surface. And if we can, like Ginger said, develop a community of data superheroes, there's so much good we could do in the behavioral health world. So we're just excited and enthused about it.
Great. Thanks, Sean. Anything you wanted to add, Gary?
Nothing that hasn't been already said. The tools that we've developed are absolutely amazing. Then they allow agencies that have never had data in the past to finally get the data in a format that they need, and have their staff have access to the data without having to go through IT for every little drop of information that they need. So it breaks that link between the technology and the data, which allows you to become a data superhero.
That's right.
All right.
All right. Well, thank you all for attending today and participating. If you would like to, we would love to continue the conversation with you. If anyone on the webinar live would want to put their email address into the Q&A, we will reach out and schedule a time to talk to you. Or if you're watching this on the replay, we're sorry you missed us live, but we would love to talk to you. We would love to continue the conversation. If you think of some questions you have that you would have brought up if you were here, send us an email. We've got our email address here on this slide. It's info@phidw.com. You're welcome to call us. But yeah, we're just excited about taking these steps to help further the sort of data literacy of the behavioral health industry. And we appreciate you taking the time to spend with us today on this Friday. So thank you all so much. And if there's nothing else, I'll go ahead and say goodbye.
Thank you, everyone.
Thank you.
All right. Thanks, everyone.